Hello students, welcome to Module 6. Your body system that you're going to be working with this for this module is the thorax and the lungs. And so you can see what your module overview is here. You can see what your outcomes are for you as a student. You're going to be looking at the anatomy and physiology of the chest and lungs. You're going to have some information that's going to show you how to do that. That'll be provided for you. You're going to be describing and understanding the equipment that you're going to use for a chest and lung examination. You'll talk about a health history, the physical examination, and what the differences is between infants, adolescents, pregnant patients, and older adults. And then you'll see what the difference is between a normal and abnormal. As you know, there are resources in the chapter. Right here it tells you what your activities are as far as what you'll do. It shows you where your reading comes from. Under the resources to enhance learning, I'll show you that in just a moment. Your review skills checklist, you can see that. You can find that on the point. This is the resource that comes along with your textbook that shows you about thorax and lung examination, and there's some worksheets and things there. And then also be sure that you look at your Bates videos in the Bates visual guide that you purchased access to. Because you'll be responsible for a respiratory assessment on your final, where you'll have to demonstrate a head-to-toe examination, so you'll need to be able to perform a respiratory assessment as part of that. So be sure you're looking through all your resources, you're studying that. Then let me show you what's inside your resources to enhance learning. I'll open that up for you there. You'll see you've got faculty notes. These are always good to review those. Make sure that you've covered these concepts that are found in the faculty notes for your exam that you have. Your module 6 and 7 are included on the next exam. And then this content will also be on the comprehensive final exam. You've got some diagnostic studies which go along with thorax and lung. You have Cocky Cliff Notes about the thorax and lungs. You also have access to a lung sound reference guide. You can click on your link there. Your normal and abnormal lab sounds. There's all kinds of information that I've posted in here for you. You've got an interactive guide. You've got a link to the American Lung Association, to the Merck manual, to palpating thoracic expansion, performing a diaphragmatic excursion, and then putting it all together, assessing the thorax. So there's lots of visual guides for you in addition to your videos that you have access to. So be sure you work through those as far as your understanding for this content. And then if you'll look on down, what you'll see is you've got a body system assignment here. It has your resources listed here for you again, but if you open this up, and I'm not going to open it up, but I will read part of it for you. I'm going to tell you it's very similar to what you did in your last assignment. And in Module 5, the way that it's laid out, you have 4 parts to this 100-point assignment that you have here. And it's talking about the lungs and thorax. So the first thing that you're going to do is you're going to conduct an online search on the age-related changes in the thorax and lungs. You're going to list abnormal findings and the expected changes with aging. And so be sure, like you could use some of those, like the American Lung Association or something like that you have access to. You can also use your textbook as well. This is just letting you use part of your resources to answer this question here. Be sure that you include an in-text citation on that. It asks for that as far as supporting evidence, because we don't just come up with our answers. We have our answers that are coming from what we've read, and our understanding of that is our answers that we have, but our answers are supported by the literature. So be sure you include an in-text citation, and then at the bottom of your document that you create, then you'll include the full reference there. In part 2, you're going to be listing risk factors for lung cancer. You can find those on the American Cancer Society website. You can also find those on the American Lung Association website. List risk reduction, teaching tips for lung cancer, and what's the prevalence of lung cancer. You can find all of those in those resources that are provided for you. Then part 3, it's just got kind of a small case study. It says a patient is admitted with TB, and what should the nurse's approach to the assessment in the lungs and thorax in this patient. So when you're thinking about the nurse's approach to this patient, I want you to think about several things. What would be different about the lung assessment if you know that this patient has a diagnosis of TB? What would you need to do for your protection, for their protection, for other patients' protection? And then how specifically would you do this focused assessment on this patient once you took care of those? So that's what I'm talking about when I say what is the nurse's approach to assessment of the lungs and thorax. And then in part 4, it tells you that a patient comes into the clinic, they've got weakness, difficulty breathing. It gives the scenario there. You find out that they're an industrial worker, they've had an exposure to asbestos, and they have a family history of lung cancer. And then there's 3 questions that goes with it. It says, what are the diagnostic test that would be ordered for this patient? What would be an appropriate differential or working diagnosis for this patient? And this is, you've been doing those. You've got your differential diagnosis book, and so a lot of the information can be obtained from there. And what should the nurse emphasize during the physical examination? And you need to think of this twofold as well, because you're going to emphasize, if you think about what they've said about their family history or what you found out about their family history and their exposures, they've got risk factors, so you're going to emphasize some of those things. But you're also going to emphasize some education. You're going to emphasize the way that they need to be examined, some of the procedures that will need to be done for this patient and that kind of thing. So it's not just one straightforward answer. It's a discussion type answer where you're providing several different points there. So your grading rubric does say that this is a 100-point assignment. It says for 80 points. I guess that means that there's 20 per each section. You accurately and thoroughly answer the questions, and then there's 20 points that are appropriated to your use of in-text citations, scholarly references, no spelling and grammatical errors. So just be sure that, when I'm saying scholarly writing, I'm not talking about, a cover page, or something like that. What I'm talking about is scholarly writing where that you're sure to use correct grammar, correct punctuation, you're including in-text citations, and you're including your full reference at the end of that. Your sentence structure is correct, and that, there are no spelling errors, things like that. That's what I'm talking about when I'm saying scholarly writing on these, because we're not, thinking that you're writing a paper, you're answering questions, but it does need to be, accurately written, instead of using slang or abbreviations like you would use if you were writing out a nurse's note. So I hope that's helpful to you. I hope you'll enjoy this assignment and learn a good deal from it. I'll be talking with you soon.